Hi, my name is Tim. I'm going to be your physical therapist today. Today we're going to perform a Astrand cycle test. It's a 6-minute test, and we're going to use it to calculate your submax VO2. And then we're going to use your submax VO2 to calculate your maximum VO2. And we're going to use that to assess your cardiovascular health. Okay. We set the seat to the height of her greater trochanter. Her legs are at a 5-degree bend, and she's been warming up for 2 minutes and 30 seconds now, so we're going to start the test in about 20 seconds. And we did her cardiovascular risk stratification, and it turns out that she's in a low cardiovascular risk. And we took her resting vitals, which was 112/58, and her resting heart rate was 74. So we're going to increase the resistance now to 1.7 and start the test. Okay, and now so we've started the test. Make sure that at any point you feel lightheaded, dizzy, or anything, make sure you let me know, and we'll stop the test and we'll take care of it. Make sure that you keep your RPMs at 50 RPMs, so you can see that here. So make sure you tone it down a little and stay steady. And we'll test your vitals at minute 2, so in a minute and a half from now, and then we'll test it at minute 5 and 6. And we'll see where you're at. So, feeling okay so far?
Doing good.
Great. Okay. That's good.
Yeah.
Okay. About 1 more minute until we start testing you. So we're going to be testing you on a Borg scale, RPE, which is relative perceived exertion. So you're going to rate yourself on a scale of 6 to 20. We use this scale because it correlates well with heart rate. So there should be a correlation there. Okay, about 30 seconds. So I'm going to let you familiarize yourself with the scale. Keep your hands there on the handlebars. And when we get up to the 2-minute mark, we're going to have you give me your RPE, and we'll go from there. Okay, now would be a good time. What do you think your relative perceived exertion is based on this scale?
About 12.
About a 12? Okay, and now I'm going to take your heart rate. Okay, her heart rate is at 30, which is about 120. Yep, so that's about 120, so we need to increase her heart rate a little more in the final test to get her within the range. All right.
Oh, really? If you don't know like where it is, you're trying to go.
Okay, and your blood pressure is 130/60. That's good.
Yeah.
Okay, now we've got about 2 more minutes before we test again. And, so are you feeling okay? You're feeling all right? Okay, that's great.
So your brachialis is from and then that's right under there, right? Yeah, it's brachioradialis.
About 1 more minute until we test again. So Just keep it up at 50 RPMs. Okay, it's about 30 seconds until we test again. I'm going to get the scale out for you and let you look at it.
Also middle and interiors. Watch superior.
Okay, about now would be a good time. What do you think your RPE is?
13.
13. That's great. Now I'm going to take your heart rate. That's at 36, which should put you at a 144 heart rate. So that's within the window that we want to be in for the submax testing. So that's good. And okay, you're at 144 over 60. So her diastolic is still staying the same, and her heart rate is increasing, has increased with workload, which is good, is what we expect. And now we're going to start testing again for the 6 minute. We want her heart rate to be within 5 beats per minute of her previous heart rate. All right, that's at 37, so that'll put her at 148 beats per minute, which is good. And could you really quickly tell me what your RPE is?
13.
13. Okay, and we're going to take her blood pressure one more time. All right, so that was at 144, 144 over 60. And so we're going to begin the cool down, and we're going to monitor her vitals during her cool down as well. So we're going to take down the resistance, and we're going to cool her down for 3 to 5 minutes and try and get her vitals close to 10% of her resting vitals. So that's good. And we're also going to monitor her vitals during a passive cool down. So that'll be after this cool down. So, great. Thank you.